Italy reported 793 coronavirus deaths on Friday, the highest one-day death toll of any nation since the outbreak began.
The country's COVID-19 fatality rate, or death rate, the number of deaths divided by the total number of cases, is higher than any other, at about 9.5%. The U.S., by contrast, has a death rate of 1.2%.
A country's death rate constantly changes as new cases and deaths get reported, and it varies based on how many people get tested for COVID-19. 1 week ago, for example, the U.S.'s death rate was 1.7%, and Italy's was about 8%.
More than 400,000 people worldwide have been infected with the new coronavirus, and at least 18,000 have died.
Because countries' case totals and death tolls are constantly changing as the coronavirus outbreak evolves, their death rates are not static, nor is the global rate.
On Monday evening, the global death rate hovered around 4.4%, according to data from Johns Hopkins. That's higher than the World Health Organization's March 3 estimate of about 3.4%.
A recent study, which has yet to be peer-reviewed, from a group of Chinese researchers suggested the rate could be lower. Researchers found that the probability of a person dying after developing symptoms was about 1.4% in Wuhan, China.
For comparison, here's what the death rates looked like on March 17.
The U.S.'s death rate dropped again in the week since, from 1.7% to 1.2%. According to the COVID Tracking Project, a testing tracking resource from two journalists at The Atlantic and the founder of a medical data startup, the number of people tested in the U.S. almost quadrupled during that time.
Widespread testing could mean a lower death rate because most COVID-19 cases, about 80%, are considered mild. Often, the cases tested and reported first are those with severe symptoms, since those people go to the hospital. Milder cases, on the other hand, could go uncounted or get reported later on, so the true number of infected people is likely much higher than the reported total.
The death rate of a disease is different from its mortality rate. The latter is the number of deaths out of the number of people in an at-risk population. A death rate is not a reflection of the likelihood that a given person will die.
According to Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, COVID-19's mortality rate is probably about 1%, which is still about 10 times the flu's.
Tyler Sunmaker contributed reporting to this story.